think if you're constantly on the internet these days, there's always a new treatment out. There's one last week, there'll be one next week, and these are the perfect cure for all cancers. My cancer is a very specific genetic mutation. Maybe 5% of people will have this genetic mutation, so 1 in 20 people can only use this drug. The other 19 out of 20 have to find another mutation or immunotherapy that might help them. So I was very lucky that mine was picked up, the proper one was picked up at the time, and I was given the correct medication very quickly. So that was my first line treatment, and I've been on my first line treatment for pretty much the full 26 months. Prior to diagnosis, I could hardly walk upstairs. Within 3 weeks of getting my treatment, I was able to play sport. I was on the golf course. So I was able to play sport again, which I didn't think I could possibly do. I really felt, after a long time of things going wrong, that maybe this was quite serious and I wouldn't get out of it. I think that some of the treatments are harsher than others. My treatment, it resulted in the big D, all cancer sufferers call it, the big diarrhea, and lots of nail issues, and I still get them occasionally, a wee plaster here. The price for that, to still be here 26 months later, it's priceless. As for other treatments, you go for the one that suits you best, whether that is chemotherapy, if that's the only one that's available. You really should go for it because it gives you a fighting chance. It's very important. You have hope. If you just sit back and just let cancer beat you, it will beat you. You do have to fight, and I don't mean in a heroic fight. I don't like that phrase. I mean just be aware of your own body, contact your doctors, make sure your oncologist is aware when things aren't going so well quite quickly. My drug specifically, we had to reduce the dosages. It was just as effective halving the dosage than it was at full dosage. So don't feel you can't tell your oncologist that. If they're switched on, they'll know anyway.